Oh, there is a timer right there. Oh, this is so cool. This is really groovy, but then I don't know how to use it. But hey, anyways, I'm very happy to be here today. My name is Rebecca Stevens, and I head Access Partnerships for Novartis Social Business. So I know that the social business piece already gets people thinking, what does she mean by Novartis Social Business? Here is a pharma company and a social business, and that already sounds a little bit maybe suspicious to some of you. But let me just explain very quickly what Novartis does in the global health space. We have been experimenting with several different models since 2001. And what we're hoping to do is really play our part and play our role in ensuring access to medicines for populations around the world. So the first program that we started experimenting with was with our Malaria Program, and that was a very simple program where we committed to the WHO to providing our malaria treatment at cost to malaria endemic countries around the world. We also worked on a pediatric version that Viveka mentioned with Medicines for Malaria Venture, because we were asked to develop a child-sized medicine for pediatric patients. After the malaria initiative, and I should know a lot about it because I was in the initiative for 10 years, whenever I went into ministries of health, the one question that I kept on getting from ministries of health is, we don't only have communicable diseases in our countries. We have very high rates of hypertension and diabetes and cancer, and what is Novartis going to do about this? And I took that back to my company, and at the time, we were like, what do they want us to do about this program? What do they want us to do about this burden of disease? So in 2015, we launched an experimental model that we call Novartis Access. And so what we did is that we looked across our portfolio, because Novartis houses an innovative pharma piece, and also Sandoz, which is the second largest generic company in the world. And what we did is we looked across the portfolio, we matched it against the WHO EML list, and we decided to offer a portfolio of drugs, 15 medicines, to address hypertension, diabetes, breast cancer, and asthma, and to provide these drugs to governments at the price of $1 per month per patient. Now, of course, I thought that the minute that we launched that, all the governments would come running and they'd be so excited about this initiative. That did not happen. And we're working on it. It's getting uptake, but it's taken a lot longer than we would have hoped. And then, of course, we have a leprosy donation program where we donate leprosy medicines to patients around the world. And we have another program called Healthy Families, which is my personal favorite, because what we do with this program that has two arms, it has a social arm and it also has a commercial arm. And what we do is we go into villages and educate communities about different diseases, because that's the important piece. If you don't know you have hypertension in a village in Sierra Leone, you are never going to go seek treatment. So the education piece is really, really important. So we educate, we have people that are called health educators that go in and educate people. And then once patients are educated, we ensure that the facilities and pharmacies in their communities actually have medicines for the diseases that they may have. So not just Novartis medicines, any company can provide their medicines to these pharmacies, but we just make sure that there is a continuum of care, that patients actually have access to drugs. So some of the challenges that I have faced and our company has faced, Novartis wants to play its part. We want to be a good corporate citizen. And why? Because our employees are human beings, just like you. And they want us to do good things. But whenever we reach and start trying to talk to some of the NGOs, we usually have a situation where there's a huge lack of trust and where they think we absolutely have an agenda. And it's not necessarily an agenda. If you look at the generation, you look at your kids or grandkids, Generation Y, and the way they think, they're not going to come work for Novartis if we're doing horrible things. So we, in a way, we want to be, playing our part and playing our role. It's important. And I wouldn't be working in Novartis if they didn't do good things personally, and I'm not Generation Y. And then what else do we face? When we get into countries and we're funding programs, we are keen to have partners at the table that will also have a stake in the game. People that will commit to a program, because we can fund something for 10 years. We don't necessarily want to fund it for 50 years. So we need to sort of see that there is a sustainability plan somehow, that we can gradually fund less while maybe the government or another partner takes on more funding going forward. And so often when I come in with a project, the first thing people at Novartis ask me is, what's your sustainability plan? And I can't tell them I have one, because sometimes it's just very difficult to actually have a really key one in place. Some of the other challenges, supply chain, and we've played our piece, because I remember one of the first sort of conferences I went to when I was in the Malaria Initiative. It was in New York City, and the lady at the back of the room said, "Are you sure that the drugs that you make actually get into patients' mouths?" And I was really surprised about this whole thing. And she says, as a pharma company, you need to play a role in strengthening supply chain to make sure drugs get to patients. You know, you can't just, it can't be hands off. You can't just ship a drug to a country and just sort of say it's going to get to patients. So we invested in health system strengthening activities like SMS for Life, monitoring stock at hospitals and healthcare facilities to make sure those drugs actually got to patients. But the supply chain is a big challenge, you know, and getting more partners in that space is going to be really, really important. So those are some of the barriers that we face, the lack of trust. Some of the best partnerships that I have put in place right now in the non-communicable disease place is our partnerships where when I go into the room, there's not that look of suspicion or withdrawal. You know, I remember some of the meetings in the early days when I sort of was in the room at the Global Fund, and they were at the board meetings, and they would say, the sector. And I was wondering, what is the gap? Why is there a gap? And they would constantly say, the sector. And I finally figured out that the gap was actually private, and they just didn't even want to say the word private. So, so we've come a long way. You know, we really have come a long way, and I think that some of the partnerships that we've had with MMV and with DNDi and some of the other, you know, product development partnerships have actually shown these organizations that we're human beings as well. You know, there's not this big monolithic pharma company making all these horrible decisions and trying to charge extremely high prices and all of that. So I think I would just end by saying we want to be partners in this because we see our role in society. We make drugs to make people get better. And we don't necessarily make drugs to just make people in the north get better. We make drugs to make sure everybody around the world gets better. And so I'll conclude by that, you know, more trust, more willingness to do collaboration, but true collaboration, not hypocritical collaboration where you collaborate and smile, and then when the pharma company or the private sector company leaves the room, then you talk bad about that person. But real, true partnership and collaboration, I think, is key. If we're trying to achieve goals of better health or universal health coverage for all patients around the world, because everybody is entitled to good health. We need to work together. We need to have true partnerships. We need to have candid discussions because we might not always agree, but it's important to just look at each other as equals and to really have those really candid, real conversations to really get to a good outcome. Thank you very much. Thank you.